We are live.
Hey guys, I welcome to our new podcast, Synapse. I am Dr. Donna Ayala. I'm a board certified family medicine physician. I'm out of Amarillo, Texas, which is in West Texas, if you're not familiar where that is. But I have a pretty wide scope of practice being in family medicine. I also do a lot of hormones, peptides, and weight loss. I also do some aesthetic medicine.
That's quite the intro. I love it.
Thanks. Thank you.
I'm Quentin. Everybody just calls me Q. You guys can call me Q. I'm the founder and CEO of Volani, a tech app. We're on the Apple Store. Look us up. If not, totally cool. And then I also own a consulting agency in terms of software development, advertising, and stuff like that. So the idea behind Synapse is it's when ideas jump specifically, right? Is there a better way you would explain that in the
No,
brain?
I mean, ideas jump or just like a transfer of knowledge, and I think that's why, I know it's a really weird pairing. You have a physician and you have a guy in tech, and you think, like, whoa, why are these two people having a podcast together? But I think it's really cool because you get a layman's side of each side of our specialties. So when we speak about health or medical things, Q's here and can kind of speak from the general public's point of view. And when he gets really techie, I'm not very techie. I can be the layman's point of view, and it's kind of just a transfer of knowledge, is what it is.
Yeah, it really is. I love that. So let's dive right in. You wanted to talk about,
So I wanted
yeah,
to talk about really like um kind of like how AI, well, and just the internet in general is transforming medicine, mainly from like a patient to provider consumer standpoint. I think there's just so much information at people's fingertips right now, um, on health, on things, which is great. It's great that people can learn about their health and learn about things that are happening to their bodies and go into physicians' often offices with questions. But, social media also gives everybody a voice, even people who maybe shouldn't have a voice in
it's
medicine,
true.
say.
Very true.
And I think it's really hard for people to decipher who to listen to, what's real, what's not real, what's safe, what's not safe. And I also think that, patients can come in and with AI do research on certain things that are going on with their body, and they don't know how to interpret that data. And so oftentimes I'll get patients that come in and ask me like they want a cancer workup or like some crazy thing that the internet told them is going on based on like a differential. In medicine, we have what we call, like, you come in with, I don't know, a bloody nose, okay? And I have a differential. My differential would be, what are all the things that can cause the bloody nose and what is the most likely? Now, as a doctor, I'm going to be very objective. I'm going to start with the most likely cause of that bloody nose and also look at the full picture. What are other symptoms? What are other things that can give me clues as to what's going on? Whereas if you're looking up your own disease course or your own bloody nose, you're going to fixate on the worst thing possible. You
Mm.
can be like, oh my God, I have Churg-Strauss disease, which is some immune disease with like,
it it gets dark very fast. Just looking
yeah,
at the worst case scenario. Yeah.
yeah. And so, like, oftentimes we're put in these situations where we're trying to justify, like, we're not trying to ignore the patient or whatever, but we're trying to kind of talk them off a ledge and take a step back. And I do feel like it's made challenges to the profession Also, there's things like there is so many things coming out nowadays with health and nutrition and even supplements. And I have patients come and have you heard of this supplement? Have you heard of this? And like sometimes I haven't. You know, there's just so much stuff that I as one person cannot keep up with. And I'll tell them like, hey, I'll have to look into it. I'll have to research it. But with the internet and the ease of information, it's overwhelming for patients, but it also creates an overwhelming kind of different challenging environment for physicians too, you know. And AI can be a tool too. I mean, there's AI for physicians where literally we can plug in a patient diagnosis or symptoms and see what it comes up with. But I think that's beneficial because we know how to interpret the data,
Mm.
right? Whereas not everybody does know how to interpret the data.
So when you get a patient now, because AI has been around for a little bit, how often are they coming in? Let's just say out of 10, 10 being the max opportunities that a patient could get something right. How often are they close to what's really going on versus they're just far off?
I don't know. I don't know if I can really answer that. Um, in like in the sense of like how many patients. I wouldn't say it's
So let's
that
say 10
often.
come in and they're like, hey, Dr. Ayala, I've been feeling this, and that. I've plugged in your AI. Grok says I have XYZ. Like
Yeah.
how often, how often are they correct?
I mean, I wouldn't say I get that exact scenario often. So like I've maybe only gotten there like once or twice, and I
Oh,
can't, you know, exactly from AI.
right.
AI specific. So I don't think I have enough data to really like report on that. Also, I can't even bring a specific patient up in my head right now to like tell you. Um, I just know that like I do have similar interactions of this.
Interesting. And so AI on your side in terms of interpreting data, share with me and with everyone how that makes your workflow better.
Um, Sometimes it can dilute the information faster. So a lot of like, you know, physician there's something called up to date or websites that are about a certain disease that only physicians have access to are very detailed, right? And when I'm in a patient room, sometimes I have to access information very, very quickly.
Hmm.
Actually, I had a patient today who had worms, schistosomiasis in her urine. And you know, I learned that in medical school, but we do not live in an endemic area where we have schistosomiasis or parasites. I do not treat this every day. In fact, I didn't treat it my entire residency. I had learned about it, so I knew about it, but I had to quickly pull up the dosage information of and the name of the medication because I didn't remember it to treat schistosomiasis. And, you know, if I pull up a typical website, I would have to scroll down and look through the differentials and then look
Hmm.
through the table of the, you know, medication and dosing and kind of do more reading. Whereas AI kind of presents to me in a little present box, like a little bow on top, you know? I still don't 100% trust it. So I did verify it with
Okay.
my regular website. I'm still a little cautious of it. Um, so I did verify it, but it was correct. And I treated her with something called praziquantel. You know, did the math. It was 60 milligrams per kilogram, divided into 3 daily doses. And so that was really nice. It's really nice to get clean, quick, efficient, like snippets of information or a tool.
Yeah.
Need
Well,
it.
and as time progresses, it's going to become even more accurate because right now the way it works is AI is essentially a prediction. So a lot of people probably don't know this, and maybe they do. On the back end, when you prompt or you ask a question, it doesn't actually know what you're looking for. It's running probabilities and multiplications on the back end, and it's running through layers and layers and layers of that, and it's chunks of information that is relatable to what you're asking it. And so through the reinforcement of learning, when you prompt and you say, ah, that's not correct, that's wrong, it reinforces and updates its memory.
Yeah.
However, in terms of scale, it's just not there yet. I still think AI with certain things, it's probably more wrong than it is correct when you get into big issues and big problems. However, in the use case you're talking about, I could see that being very, very useful.
Yeah, so I think this AI, what it does is it scans like databases
Mhm.
that are existing and it just spits out information that like is
Okay.
already like
So
I think it's partnered with a specific database that it analyzes the literature. It gives me the information.
good. Yeah, that's better because then the quality of the data, well, I mean, because the worst case scenario would be poor data, poor outcome, right? So if the data is great, then your answers are all going to be pretty close to accurate if it's
Yeah.
training on solid data. The
Yeah, it
issue with,
from like data that me as a physician would use,
okay,
not like the
perfect.
entire internet.
Right.
Right.
Yeah. So, well, this is actually a great segue because when you think about AI, the way the public uses it, a lot of interesting things are AI was trained on public data, public writing. And so, just to take it away from health just from a little bit, let's say that you're a student in college or you're a young person and you wrote an essay, and the college professor uses an AI detector. The issue with that is the AI has been trained on language. So even if you were to put in the Declaration of Independence, its training says that's an AI drafted document. And so that's the issue with public data training on everything that moves through the internet. And even in today's time, the only way to pass an AI detector is actually to write like dog shit. Like you have to write so poorly and connect your ideas so badly, then the AI is like, oh yeah, that's from a human. And so all the good literature, all the good writings, all the good essays it knows is from the actual public data. So there is this dichotomy in like, okay, it's useful, but what's the quality of the data that we're training it on?
Yeah. Yeah, and I think that's kind of important too. In another form of like AI that I'm exposed to, there's the software called Heidi, and I
Mhm.
use the free version. I don't use the paid version or anything, so I don't know if there's different quality of it. But basically what it does is it can listen to a an encounter, like in the visit, it listens to it and then it creates a SOAP note. And a SOAP note is basically subjective, objective assessment and plan, like a physician notes. And most of the time, it's pretty accurate. Like it's supposed to weed out, because you walk into a room and you say, "Hi, how are you? My name is so and so," and blah, blah, blah. Like you don't need that in your notes. So it's
Right.
supposed to weed out the fluff and just put like pertinent information in there. But sometimes it puts, and I know this sounds kind of funny, but almost like too detailed. Like they put something that the patient commented, but wasn't really anything we're going to address today.
Mm.
It does a pretty good job, like physical exam. So if I'm going through and I'm like, oh, your heart sounds great, your lungs sound excellent, or whatever, then the AI will generate a physical exam note saying, normal cardiac rhythm, good S1, S2, whatever that may be, right, in medical language. Um, but then my plan, most of the time, it's accurate. Sometimes it's a little bit redundant, I think, in how it sets it up, but it is supposed to learn you over time. I think it is supposed to get better, and you are supposed to be able to teach it. And I think it can be very, very valuable because, as a physician, we have so much time taken up by like just paperwork, notes and stuff. And we need our notes. I mean, that's what saves us, heaven forbid, like in a courtroom or in plus also just like you do not understand how much documentation we have to sometimes give when
Mm.
this patient to have an MRI, or I need a sleep study, or I didn't say this specific phrase in my note to get them
Mm.
supplied with oxygen. Like it's kind of ridiculous. And I think the AI has been trained to know those things and they can put those things in there. The problem is like also that takes time to train it, right? So like It's like a double. But once it's trained and like it does better, I think it can be really valuable.
Well, it's got to learn your voice, right? It's got to know when you're talking versus when the patient's talking, which I'm sure it can do that pretty, pretty,
That
pretty,
does a
pretty,
pretty
pretty,
good
pretty,
job.
pretty, pretty, pretty. So the issue we run into there is the context window, and think of it like a bubble. And the more concise you can keep that conversation, the better it performs. The more broad it gets, the more it starts to hallucinate because each time it's taking notes or it's writing things down, it's fetching more chunks and it's going further and further out. And this is in terms of like hundreds of millions of mathematical equations it's doing on the back end to try to guess or predict what it is that you're wanting to hear. It's actually really interesting, but I'll tell you what, I think healthcare has the most to gain on both the provider side and the patient side. From the provider side, because I believe the information coming in for you guys, I think there's a much better way for you to have a holistic view of the people you're seeing. That's number one. I think there's also something to be said about whenever you discharge or they go home. I think there's a lot of, if I had to guess, I don't know, I don't work in healthcare.
Yeah.
But if I had to guess, I would assume that you guys get tons of calls after your appointments on, well, this happened. Is this okay? What about this? You know, I'm supposed to take the medicine at this time, but I ate wrong. Or I'm sure you just get so many things. And I think AI could bridge that gap as well. In
Yeah.
addition to before a patient even comes in to see you, and you might not like this because this is less money for you, but um, in terms of quality, so you just want to think of quality, and let's just call the bottom 15% of patients. I don't want to call them slot, but let's just say they really don't need to come in. It's their, it's a small cold, something over the counter, or they're a little red on their arm, and it's nothing more than like a mosquito bite or something like that. I feel like if the patients had access to their medical records and their personal AI was trained on it, then they could say, hey, here's what I'm feeling, here's what I'm dealing with. And it could say, hey, this is low level, this is high level, not necessarily giving medical advice, but saying there's 1,000, to a million different cases like this. The probability is X, Y, Z. But if
Yeah.
you start to feel X, Y, and Z, or if X, Y, and Z start to happen, then definitely going of time dealing with uh, patients that it's not necessarily severe or it doesn't necessarily warrant a visit, if that makes sense.
Yeah. No, and actually, I no, I mean, I don't think that we as physicians would mind that at all. I think actually we would like that. I just made a post about this today, about like just trying to educate a lot of people come in when the first signs that they have a cold, right? And then they
Mm-hmm.
get frustrated when we as physicians don't prescribe them antibiotics.
Yeah.
It's like they feel bad and they want something done. And so, but then you feel bad because they've made an appointment. They've paid money to see you, and you're like, take Tylenol and ibuprofen, over the counter,
Yeah.
viral. And it's hard because they want something.
Right.
And so I kind of made a post on this today, just basically educating them that it's mostly viral. Wait the 5 to 7 days that a viral thing runs a course. If you don't get better, go see the doctor. You know, if you get better and then get worse, it's likely then a secondary bacterial infection. So then it's definitely time to see the doctor because then antibiotics are indicated. Or if you want to get like flu and COVID tested, maybe that's you don't care, but you just want to know if you have flu or COVID, or you need a note for work, then sure, go and see
Mm.
the doctor. But other than that, like I think most people should just ride out their colds. I would love it. It would make our lives much easier as doctors and much better as patients to where they don't feel like we're not doing anything for them and they're not wasting their time.
Well, that makes sense. And then you're spending time, I don't want to say working on the important issues that people do face, but I do think that's really, really important. You want to spend time focusing on the severity of problems, not just every sneeze that happens. That's also just humanity. Humans, we're interesting creatures. There's a lot of funny flaws. That's one of them.
Yeah, there's nuances to that, right? Like a new mom and it's her baby and it's her baby's first cold. Like, believe it or not, as much of like I'm a physician, I'm very logical, but when it comes to my children, like I have mom brain. Doctor brain does not exist. Okay, like I can tell myself like my daughter was had RSV really bad when she was 3 months old, and I she was just rapidly breathing all night, and I'm like, kids do really well until they crash, and they compensate really well until they don't compensate anymore. And so I was like, but because I have all this medical knowledge and you just think the worst, like there was no ways I could see my own child and be like, she's okay. Her pulse is, this, her respiratory rate's this, her oxygen saturation is this. Like there was none of that. It was just my child is in distress. I need someone else who's more logical than me right now to like tell me what to do, you know? Um, and so like new moms, certain situations, like absolutely, I'm never gonna shame someone for coming in to see me, or even if they just want reassurance, that's totally fine. I'm
Right.
literally talking about the patient that like is like,
You're talking
man,
about the repeat offenders.
yeah, like why did I come to the doctor? Why can't you give me antibiotics for this sinus infection? You
So,
know?
speaking of babies, how long how far away do you think we are before parents don't have to take a chance? They can just decide, oh, we want to have a boy, and then they can have a boy. Or we want to have a girl, they can have a girl.
I
How
mean, we
far,
are there. We are there.
really?
I mean, not in like the like natural conception realm yet, but I know a lady, and I don't know like the laws regarding this if it's legal in the USA because I know if somebody I know was getting IVF in India. So I don't know if like the laws on that is different than the laws in the US, but she was able to choose an embryo, either a male or female.
No
An
kidding.
IVF. Yes.
Whoa.
So, I mean, that's possible. Now, ethical and all that stuff, that's it's a big discussion. But as far as scientifically being able to do it, it can be done. I
That's pretty
mean,
wild. I actually think that's going to be the future. I think there's going to be too many parents who are like, oh, I really wanted a girl, or I really wanted a boy. And I think the way, like, for instance, everybody's holistic now. So it's all whole foods, protein. And it wasn't like that for so long. For the longest time, it was like junk food, TV dinners, tons of bread, tons of pasta. And, the hippies had it right, you know? And so I think, fast forward maybe 20, 25 years, I do think you're going to have women who are like, no, we're going old school. We're not going to know. We're not going to choose. We're just going to, you know,
oh yeah, yeah, yeah. I see what you say. Okay.
yeah. I
Yeah,
mean,
yeah.
that's why I didn't realize we were that close. I figured, we were 10 years away from it. I'm really blown away that we already have something like that. I'm not surprised, but that is wild.
I just don't know. Like, I think that's where and there's a lot of things in medicine, tons, and we talk about this in medical school where there's like an ethical, there's science and there's ethics. And where is the line, you
Well, let me
know?
give you a good use case. So here's a great use case for that, okay? I have a friend, she has four boys, and she wanted a girl. And on her last one, because I mean, you can't keep going after four. I mean, you could, but my goodness, that's a lot. If she could have picked to have a girl, she would have done everything to pick she had a girl because she already had boys. So I think in those use cases, it's like, that's really nice. Like, yeah, you've rolled the dice, you've had one uh, gender come out, boys, all girls, and you know this is going to be your last ride, and you can just pick which one you want. That's kind of cool. Uh, but I'll push it further. I think we're going to get to a place with gene therapy and DNA manipulation. I think you're going to be able to go to a doctor and say, hey, doc, I want blue eyes, blonde hair, this type of height. And I think
But
you're
then
going to be able to do all
how
that.
is that gonna make us into like, quote, like an Aryan race, the ideal person? You know what I mean? Like that ideology.
Well, I mean, yeah, you're heading down Hitler's highway for
Well, I'm
sure.
just saying, like, when much control. Like there's a certain beauty
Yeah.
in nature,
Yeah.
right? There's a certain beauty in things occurring naturally and happening naturally. And I do think there's a certain thing that, like, as much as we as humans can control things, the question is, should we? Should we control those things?
Give me an example of something that
Well,
deserves a
that
question mark.
I think that exactly. The ability to change outcomes on like
Natural
a
progression.
natural progression. We have evolved. Evolution exists. And evolution doesn't happen overnight, right? Things don't change overnight. Things evolve over time. Genes in certain regions are expressed and not expressed. And we can only study those things in hindsight.
Hmm.
We don't know how genes are going to evolve in the future.
Hmm.
So when we start messing with nature in that way, we don't know what evolution we might be hindering,
Hmm.
is one. Number two, yeah, when you start being able to select certain things that your children have, you
Or
know,
don't have.
or don't have, like, you know, we either start to, yes, create a kind of Aryan race type thing, or racism is kind of more like what if black people decided, okay, we're going to have all white children. I mean, it takes away diverse, it could do so much, that where there's beauty in nature, and nature has a purpose. Nature's
Yeah.
smarter than us, you know. Nature, the world will live, we won't live. The
Very
world will,
true.
you know. And I just think, like, when you, to some extent, like, that's playing God. And I also think there's value in learning to love what you're given.
Mm.
I don't know. That's just me
I
personally.
like it. Let me give you the other side. I want you to know I actually do agree with what you're saying. But for the sake of the podcast to make it interesting, I'm going to give you the other side.
Sure.
Number one, so what the ideal human being is, or what the ideal specimen is so subjective. You look at the Hawaiians and thick, long hair, right? You look at the Swedish, tall, slender. You look at the Russians, stout. Um,
Mm-hmm.
you look at, let me think, track runners. I think there's so many things that we do as humans that no matter if we could pick essentially this, hey, what do I want and dial it up? Too many people find the perfect specimen subjective, right? Maybe I want my kids to grow up and be an NBA player, or do I want the next tennis player? Do I want the next long ski jumper, which is a completely different body type? So that's the other side of that, where it gets scarce, and I'm jumping back to your side. Um,
Yeah.
on the taking
What
control.
about this? What if you pick your daughter's body to be somebody athletic and muscular, right? Like
Mhm.
athletic and muscular, and she hates you for it because she wanted to look like a Victoria's Secret model. What would you do?
Well, here's the
Like,
deal. Well, I'm going to tell you, girls, they hate their parents at some point in their lives, no matter what. That's
well, I
natural.
don't add another thing for that to be an issue about. Like,
Oh yeah, sure. No,
I
it's
don't
true.
know.
Well, it becomes a slippery slope because then you say, if you can dictate DNA and genetics, and you start saying things like, well, I want them to have, the comedy gene. I want them to have the serious gene or super intelligent. I believe in nature for sure. Um,
Yeah,
yeah, I do think the positive use case would be, you know, could we use that to eliminate Down syndrome? Could we use that to eliminate certain issues that kids can be born with? Like, absolutely, that's the pro. And I will say, history shows that no matter what tools we find for good, there's always someone out there who's going to use them for bad. Uh,
yeah.
and we can
But
even go
I'm
ahead.
gonna go that you say that's the pro, but I'm not sure that is the pro.
You don't think so? What would be the
I,
pro?
Here's the thing, and again, it's like I'm not sure this is my I'm not sure I truly know how to feel about this. But like there's a lot of people with Down syndrome that like their parents I don't know anybody personally with Down syndrome, right? But there's
I
a
do.
community of these people that like they love them the
Yeah,
way
they're
that
awesome.
they don't see it as a disability.
Right.
That's one side of it. Another side of it is like same thing as in it's going back to nature, right? There is a natural selection. I mean, a lot of babies or like miscarriages occur because there is something in the DNA, like the baby wasn't going to be viable. So something happened while the baby was replicating. There was a mistake and the baby didn't wasn't viable, which is really majority of miscarriages, okay?
Okay.
Um, and a part of me is also like, that's nature's way. Like, if we could control that, we already are overpopulated. I mean, I'm
Right.
coming from a certain nature standpoint, but nature does control populations. You know, it in the animal kingdom.
Right. Does
There's
any of
population control.
does any of these miscarriages ever happen from like the mother being too stressed or anything like that?
From what?
Mothers being too stressed or unhealthy, or is a miscarriage solely the baby?
I mean, it's not so, I mean, majority of the time, that's what it is. Certainly, like, it could be stress. I would say more stress in terms of like an abusive relationship or whatever, or a lack of nutrient for some reason, or, something like that. There can be other causes, but majority of the time, it's just, it wouldn't have been a viable fetus.
Yeah, well, that makes sense. I'll tell you what, this whole idea of nature is really interesting, especially when you think about the tools we've created, AI, right?
Hmm.
Being one, the computer, another one, weapons being another one. We could go on and on and on. I love
Yeah.
this nature talk, but I want to get to your other topic that you wanted to discuss.
I feel like we kind of discussed it.
Feel like we covered it?
Yeah, I mean, it was mainly like the AI, like in medicine,
Mhm.
how it can be utilized. I mean, I said mainly the soap notes, right? But there's other things. There's diagnostic tools. It's good in radiology and stuff. So, I mean, as I say, like there's pros and cons to it. But I think that was the main. Yeah. Was there anything else you wanted to say on?
Yeah, and we'll keep this on the health topic for this one. So I read this report, it's kind of this white paper about AI when they become autonomous, physical AI, more in the robotics and the humanoid form factor. The argument for having an AI as a doctor versus having a human doctor. And I'm going to give you the benefits of it, which I don't agree with, but never gets tired, never gets stressed, can keep capacity, doesn't have to look up everything anytime it hears something new because it's constantly being trained. But here's my issue with it. And here's when I read the paper, here's what I felt. Doctors do get things wrong. But I promise you, any human who's gotten a bad outcome or poor outcome, and that came at the hands of a human doctor will feel very different than that mistake coming at the hands of a humanoid. I just
Yeah.
think that we're not ready because we understand that humans make mistakes. We are not ready to assume, nor are we prepared to have these humanoids make mistakes. And I'll give you a great example. I have a lot of friends because, I have a tech company. I have a lot of friends who use Claude or Grok, OpenAI, and they say, hey, I need you to do XYZ in the code base. And let's just say, Donna, that their code base is 60,000 lines of code. That's a
Okay.
lot of codes. That's in your world, that's a lot of charts, a lot of patient charts. And you're saying, hey, I need you to go through and organize these by, date, year, uh, the highest level of disease, whatever, whatever. And so when they ask Claude or any of these agents to go through and do something in their workspace, they have no empathy. They get very frustrated. It doesn't work. And I'm telling them, hey, You go into Shopify or you go to Dropbox code base, let them ask you one question about their code base and you go get it right the first time. And then they're like, oh my God, that's exactly what we're doing is so we have to, and this is the first time in history because you don't need it with your computer, you don't need it with your phone, but there has to be some level of empathy for the AI because it has literally very little context. And so when I read these white papers about AI doctors and AI robotics or humanoids taking over, we're so far away from humans being ready to accept the worst outcomes that
Yeah.
can happen. Does that make sense? Because see, doctors, PTs, therapists, insurance companies, we're all protected by some liability because we know humans make mistakes. It's a part of life. We're so far away from accepting any error or any rate of failure from these AI robotics. And so I say that to say I think your job's pretty safe and secure for a while.
Yeah. I don't know. I don't really see my job being taken away, but I do think now certain jobs in the medical field maybe are more threatened than others. But medicine's also a very human profession. When you when your loved one is on their deathbed, do you want a robot holding their hand?
Mm-mm.
Do you want a robot giving them that diagnosis? You know what I mean? Like I think it can be useful. I think it can advance medicine. It can help us maybe more quickly diagnose, more accurately diagnose. I think there's room for it. I don't think we need to be afraid of it.
That's a
But
healthy perspective. It's very healthy.
but I also think like, I don't want a robot holding my mother's hand when she's dying saying, "You have cancer. Let's
Right.
have the hospice talk." Because
Right.
I do this. I have patients crying
Mm.
to me, handing them tissues. I don't think they would do that with a robot. There's a human element that I just don't think could ever be replaced.
Yeah. Yeah. We're always going to want the human touch. In most industries, not all, but most. And I think
Yes.
medicine is a big one. Even
Yeah.
customer service, like, gosh, I hate talking to an automated machine. Like if I get a human on the phone when I'm calling
Zero,
support,
zero, zero, zero,
yes,
zero.
let me speak. And now I used to say, let me speak to an agent or
Yeah.
speak to a representative. Now I can't say agent because it's an AI agent.
Yeah.
So yeah, we crave human touch. Nonetheless, I think this was a great first episode.
I do
Uh,
too.
so yeah, I'm gonna sign us off. That's
Okay.
the first episode of Synapse.
Yeah. Well, we hope you join us for more. I can't tell you what the next one will be, but it'll be interesting.
Yeah, yes, it will.
Bye.
Bye.